So what happens in a pediatric evaluation and examination? Are we taking x-rays? Are we doing neuroscans? Are we doing both? It's a really good question, and the answer is we're going to do something so that we have a way of objectively measuring what's happening for your child. So the very first thing we're going to be doing is a detailed case history, and depending on the age of the child, we're going to be asking you lots of questions, even from birth and beyond, sometimes even preconception. We want to know history of illness, any falls and accidents, what's the chemical, physical, and emotional stress load that baby or child's been under from even before day one, if we have that information available. So that's going to be, and then symptom-wise, mom and dad are going to share with us, hey, here's what we're seeing happening for our baby. Now, we want to have more information. So depending on the age, usually between ages 5 and 6, if they're able to stand up, we do want to assess and make sure that there's not a scoliosis, which those are things we can look at using x-ray. But on most of our babies and kids that we see in the office, we do neurological scans. Sorry, I didn't have that in that frame. When we're working with our little babies, we'll be doing thermal scans to have a direct window into the autonomic nervous system to measure temperature differences between the right and the left side of the spine, which give us indicators for what are these babies' stress patterns. The technology we use has 3 parts: thermal scans to measure temperature differences, SEMG, surface electromyography, to measure muscle tone and balance, as well as HRV, measuring heart rate variability. And when it comes to babies, we have a little ear clip that we could put on so that we're able to measure this, and all these tests take less than 5 minutes. Now, if your child, depending on if they're able to sit still or not, or sit up or not, that can affect which tests we do or don't perform. But all of those tests give us a lot of information so we can understand neurologically what's going on and what kind of stress pattern your child may be stuck in, so we can help them break that stress pattern and function at their best.